Welcome. I'm Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. To be respectful of your time and your interests, I'll once again separate my monthly multimedia summary into different parts. Please let us know if you would prefer a longer, single-part version. In this first part, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has selected as Editor's Choice and highlights for the June 2014 edition of our journal. The second part of this recording will reflect the remaining articles on the front page of our June 2014 issue. The third and final part will discuss the online-only features on our website in June 2014 and give you a preview of the July 2014 issue. This month's Editor's Choice is the editorial Incidental Findings in Medical Imaging and Genetic Testing, Opportunities and Challenges by Dr. Lori Erickson from Mayo Clinic in Rochester, Minnesota. Dr. Erickson is also an associate editor of Mayo Clinic Proceedings. In her editorial, Dr. Erickson asks whether we can educate patients to the complexity of such testing so that they can decide which results they do and do not want. She notes that educating the public on these issues is infinitely complex, given the diverse possibilities of the findings and the potential consequences of positive results. This editorial accompanies 3 articles. The original article, Imaging Pandora's Box, Incidental Findings in Elderly Patients Evaluated for Transcatheter Aortic Valve Replacement, by Dr. Nicholas Orm and colleagues from Mayo Clinic in Rochester, Minnesota. The original article, Biobank Participants' Preferences for Disclosure of Genetic Research Results, Perspectives from the Our Genes, Our Health, Our Community project, from Nicole Allen and colleagues from the Brigham and Women's Hospital and from Harvard Medical School, both in Boston, Massachusetts, and the commentary, Genomic Medicine and Incidental Findings, Balancing Actionability and Patient Autonomy by Dr. Jennifer McCormick and colleagues from the Mayo Clinic campuses in Minnesota, Florida, and Arizona. And finally, the original article, Characterization of a Phenotype-Based Genetic Test Prediction Score for Unrelated Patients with Hypertrophic Cardiomyopathy by Dr. Martin Bose and colleagues from Mayo Clinic in Rochester, Minnesota. One of this month's featured highlights is also this month's contribution to our ongoing Symposium on Regenerative Medicine. The title is Breakthroughs in Cell Therapy for Heart Disease, Focus on Cardiosphere-Derived Cells, and the author is Dr. Eduardo Morban from Cedars-Sinai Heart Institute in Los Angeles, California. Dr. Morban points out that evidence that therapeutic regeneration of the myocardium is possible catapults the field onto a new plane yet to be achieved by any other treatment approach for heart disease and heart failure. This article and the concise review for clinicians on postpartum depression by Dr. William Bobo from Mayo Clinic and Dr. Barbara Yon from Olmsted Medical Center, both in Rochester, Minnesota, provide teaching exercises for which you can receive up to 1 hour of CME credit if you complete the appropriate documentation. By the way, Dr. Yon is also a member of the editorial board of Mayo Clinic Proceedings. This concise review on postpartum depression is, in fact, also one of this month's featured highlights. The authors explain that fewer than half of postpartum depression cases are diagnosed in typical clinical practice. Dedicated screening for postpartum depression improves the recognition of this important condition and can lead to better outcomes. The third featured highlight in our June 2014 issue is the review article Youth Onset Type 2 Diabetes, Lessons Learned from the Today Study by Dr. Surana Narasimhan from Case Western Reserve University in Cleveland, Ohio, and Dr. Ruth Weinstock from Upstate Medical University in Syracuse, New York. Dr. Weinstock is also Mayo Clinic Proceedings section editor for endocrinology. The authors discuss the aggressive, multifaceted approach that is needed to prevent or forestall premature microvascular and macrovascular complications in these young patients. This concludes the first portion of my summary for June 2014.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.